Sweetie, where are you supposed to be right now? Where's your spot? Are you? That's
The little girl is Amy, is Anna.
Yeah. And
Her
my
sister
older
is
one
Amy.
is Amy.
Yes, yeah. This is Dr. Jerry Hesch, a physical therapist at HeschInstitute.com in Aurora, Colorado. And I'm also an orthopedic manual physical therapist, so I treat joints. And I just finished a book chapter on treating the atlas as it relates to the axis. That's the first and second vertebrae in the neck. And there's a joint above that where head connects to the neck. But I'm focusing on the joint right below that. And we're blocking out Lisa's face for her own privacy. But prior to me treating her upper cervical today, she had a long history of feeling like her neck was stiff. Can you give us some feedback on how your neck felt?
It never felt like it moved very well, and it always felt like it was in a forward position. So I struggled to kind of lift my head up when in a plank position, or even in the car, to get my head all the way back to the headrest.
And you couldn't use a ponytail.
Right.
That was uncomfortable.
Yes.
And what I found was that you had no traction mobility of the upper cervical spine, and the way we isolate the upper two joints, they're in the front of the neck, whereas all the other facet joints are in the back of the neck, is that we do traction in this part of the head, and we do it in a specific position. In neutral, I couldn't get this kind of mobility. This was just really stuck. There was no give. And I also brought this table up, this headpiece up, and we tested her in flexion, and there was no movement at all. And then we also tested her in extension, and there was no movement. And so we treated her by placing her head in 10 degrees of flexion. And again, contact was right here. And I had her tuck her chin backwards. That's very important. So the posterior glide is important because it'll move the second vertebrae posteriorly and create a little bit of space where the dens, this vertical portion of the second vertebrae, articulates with the front of the ring-shaped vertebrae C1. You don't really need to know all that, but for therapists who are watching this, I thought I'd get a little technical. So then what I did was I contacted again on the temples, in front of the ear and above, and I did very gentle traction. I just tractioned it to a stop point, and if I were to measure this amount of force on a fish scale, pulling it, or a luggage scale, it would read about 15 pounds. And we did that for only 2 minutes. Okay? In response to that, she now has beautiful mobility. I can see her feet move up and down. And that moves in flexion, in the position in which we treated it. It moves in neutral position. And it moves in extension. So now, I'm going to film for her husband how to help her with this. And once a week, 2 minutes, and he can help you with this. And I'll also show you a self-treatment technique, which is simple posterior glide of your chin, gliding your head backwards, and then looking downwards just slightly. So you could put a pillow under your head, and then tuck your chin backwards. Good. Gently, gently, gently. And now do little tiny nods looking down. Just little tiny, yeah, downward chin tucks. Yeah. I want you to do 30 of those a day for a week. And then I want you to do it twice a week. Okay? So, it's important to ask how you feel. How do you feel in response to this treatment we did today for 2 minutes?
As I sat up and I walked around, I felt like my head was hanging back. I think it was in an upright vertical position, but it was so used to being forward, it felt as though it was hanging back.
Okay, is hanging back good?
I think so, yes. It definitely felt like a changed position.
Okay, so sit up again, or stand up, either way, and move your neck around. How does your neck motion feel looking up and down and side to side?
I think much more mobility going up
Uh-huh.
and more mobility left to right. Still a
Okay.
little tight going to the left.
All right. And then walk down the hall and then come back. And how do you feel walking?
Definitely feels more upright. I don't think it feels quite as like it's hanging back as it did the first time.
Okay, okay.
More upright.
Can you stand sideways? And can you show us how your head felt positioned before?
I think probably more forward like
Yes,
this.
glided forward, like a
Yep.
sort of like a turtle, yes?
Yep.
Got
Probably
it.
an exaggeration, but
Okay, and now it
And then
feels like
forward.
it's come back a little.
yeah.
Okay, very good. Did you have pain before?
I had tightness and
Yeah.
stiffness
Okay,
in my neck, particularly along the left side.
okay. Is that improved?
It is, yes.
Good.
I don't feel that, especially up here, kind of at C1,
Yeah,
just that awkwardness.
sure.
Yeah.
So now I'll film a repeat of that self-treatment that we just did with you, and I'll film how your husband can help you with his traction once a week, and of course do the same thing to him.
Yeah.
Get him hooked on it.
Right.
It's a
Sounds
trick.
good.
It's a trick.
Yeah.
Thank you. It's
Sure.
really helpful for me to be able to film this and share it on
Yeah.
YouTube. Thank
Okay.
you.
Yeah.
And
Because I'm standing up to see how it feels, sweetie.
I have a book chapter that'll come out in 2020
Okay.
on doing
Yeah.
that treatment. It goes into a lot of detail about
Right.
about theory.
Okay.
So I'm excited about that. Thanks.
Yeah. Sure.